Things They Don't Tell You Part 12. This is an actual human brain. The top part is the cerebrum, the bottom part is the cerebellum. The cerebellum, you may recall, is responsible for balance and coordination. And in my world as a cancer doctor, sometimes we hear the story of a patient who's coming in with balance issues, and then we do a brain scan, whether it's a CT scan or an MRI, and then we find a mass in the cerebellum. Other times they might have trouble speaking, and then again we do a scan and we find a mass in Broca's area, which is in the frontal area of the brain. Now, regardless of where it is, usually it's some conversation with, well, we want to radiate it or we want to surgically remove it, and then we'll start systemic therapy like chemotherapy or immunotherapy. Again, that's a conversation to have depending on how well the patient is doing. Meaning if you have an 85-year-old who's not in the best shape, you're probably not going to be able to give that person chemo. It's too toxic. Likewise, you might not be able to do surgery because it's hard to recover from surgery. But if you want to do something like radiation, that also has its side effects. And then even radiating parts of the brain, even though it doesn't sound as intense as surgery, can also have side effects that cause swelling around the brain that could also have